Aspiration pneumonia is a complex condition affecting the lungs. This video will provide medical students with a detailed understanding of its definition, causes, symptoms, diagnosis, treatment, complications, prevention, prognosis, and current research. Case-based learning will also be incorporated to improve diagnostic and management skills. Aspiration pneumonia is a lung infection caused by the inhalation of oropharyngeal or gastric contents. It occurs when the body's upper airway defense mechanisms and swallowing reflex are not working properly. The process involves the interplay between aspirated material, the body's defenses, and microbial agents. The presence of foreign material can cause tissue damage, and the aspiration of bacteria can lead to inflammation and infection. Various risk factors contribute to the development of aspiration pneumonia. These include advanced age, dysphagia, impaired cough reflex, altered mental status, intubation, mechanical ventilation, oropharyngeal dysfunction, and gastroesophageal reflux disease. A thorough assessment of these risk factors is crucial for identifying patients at a higher risk of aspiration pneumonia. Once identified, appropriate management strategies can be implemented, including lifestyle modifications, pharmacological interventions, and supportive care. The clinical presentation of aspiration pneumonia can vary widely, making accurate diagnosis challenging. Common symptoms include fever, cough, purulent sputum, chest pain, dyspnea, and altered mental status. Physical examination findings such as crackles, decreased breath sounds, and dullness to percussion may also be present. Radiographic imaging, such as chest X-rays and computed tomography scans, can aid in confirming the diagnosis and assessing the extent of pulmonary infiltrates. To establish a diagnosis of aspiration pneumonia, a combination of clinical, radiological, and laboratory findings should be considered. Diagnostic criteria typically include the presence of a suggestive history of aspiration, new infiltrate on radiographic imaging, and evidence of infection through laboratory investigations. Radiographic findings often reveal patchy or lobar infiltrates, consolidation, or abscess formation. Additionally, sputum cultures and blood tests may be conducted to identify the causative organism and assess the severity of the infection. Aspiration pneumonia can be caused by a variety of microbial agents, with the most common being oral anaerobic bacteria, followed by facultative anaerobes, gram-negative rods, and Streptococcus pneumoniae. The choice of antibiotics depends on the pathogen involved, local resistance patterns, and the severity of infection. It is crucial to consider antibiotic resistance, especially in healthcare-associated aspiration pneumonia cases, as multi-drug-resistant organisms pose significant challenges in treatment selection and patient outcomes. The management of aspiration pneumonia involves a multimodal approach, including antibiotic therapy and supportive care measures. Empirical antibiotic treatment should be initiated promptly, considering the most likely pathogens and the clinical severity. Proper selection of antibiotics should be guided by local susceptibility patterns and patient-specific factors. Supportive care measures encompass oxygen therapy, bronchodilators, chest physiotherapy, hydration, and nutritional support. Close monitoring of vital signs, oxygenation, and response to treatment is essential. Complications and sequelae can arise in the setting of aspiration pneumonia. These include lung abscesses, empyema, respiratory failure, sepsis, and acute respiratory distress syndrome. Prompt recognition and management of these complications are vital for improving patient outcomes. Surgical interventions, such as drainage of abscesses or empyema, may be necessary in selected cases. Rehabilitation and respiratory therapy can aid in restoring lung function and preventing long-term sequelae. Preventing aspiration pneumonia involves a multifaceted approach targeting modifiable risk factors and optimizing patient care. Strategies include promoting good oral hygiene, addressing dysphagia with speech and swallowing therapy, optimizing nutrition, elevating the head of the bed during sleep and meals, minimizing the use of sedatives or narcotics, and avoiding unnecessary intubation and mechanical ventilation whenever possible. Implementing preventive measures plays a crucial role in reducing the incidence and recurrence of aspiration pneumonia. Managing underlying conditions that contribute to aspiration risk is paramount in preventing aspiration pneumonia. This topic will explore case-based approaches to managing conditions such as neurologic disorders, dysphagia, gastroesophageal reflux disease, and obesity. Treatment options may include pharmacological interventions, lifestyle modifications, and surgical interventions aimed at addressing the specific underlying causes of aspiration risk. The prognosis of aspiration pneumonia depends on various factors, including age, comorbidities, severity of infection, and timely initiation of appropriate therapy. Mortality rates can be high, especially in elderly individuals and those with significant comorbidities. Understanding the clinical course, potential complications, and long-term outcomes is crucial for prognostication and patient counseling. Rehabilitation and comprehensive follow-up care play a vital role in optimizing long-term outcomes. This topic will provide an overview of recent advancements and emerging research in the field of aspiration pneumonia. Areas of interest include novel diagnostic strategies, advancements in antibiotic therapy, targeted therapeutic interventions, immunomodulatory approaches, and vaccine development. Understanding the current state of knowledge and ongoing research initiatives will help medical students stay up to date with the latest advancements in the management of aspiration pneumonia. Case studies and clinical scenarios will be presented to further enhance diagnostic and management skills in aspiration pneumonia. Through these interactive examples, students will be challenged to apply their knowledge and understand real-life situations encountered in clinical practice. Emphasis will be placed on integrating multiple aspects, including risk assessment, diagnostic criteria, treatment options, and therapeutic decision-making based on individual patient presentations. In conclusion, aspiration pneumonia is a significant healthcare problem. It is important for medical students to understand its definition, causes, diagnosis, treatment, complications, prevention, prognosis, and current research to effectively manage this condition in their future practice. Continued research is crucial for better patient outcomes.